most of the patients would regain their complete movement in a span of about 2 to 4 weeks. Prevention of frozen shoulder is very important. Whenever you have an injury, it is very important you do not keep the shoulder in prolonged immobilization. Hi, I am Dr. Veerendra Mudnoor, consulting orthopedic surgeon at Apollo Spectra Hospitals, Kondapur, Hyderabad. I am specialized in arthroscopy and joint replacement procedures of the hip, knee and the shoulder. In this video, we will talk about frozen shoulder. Frozen shoulder or adhesive capsulitis is a condition where patient has pain and stiffness of the shoulder joint. It is usually secondary to prolonged immobilization, diabetes or other systemic conditions. Here, the patient has pain, stiffness and decreased movement of the shoulder. The management of frozen shoulder involves conservative treatment where we give analgesics, physiotherapy and try to treat the systemic conditions. If the frozen shoulder is secondary to a systemic condition like diabetes, your diabetes has to be well controlled. If there are other associated conditions like autoimmune disorders like rheumatoid arthritis, they need to be addressed. For patients who do not have these systemic conditions, if it is secondary to prolonged immobilization, which could be secondary to a dislocation of the shoulder or a small trivial injury, patient is immobilized for a longer duration, they would also develop frozen shoulder. Frozen shoulder for many patients is self-limiting, where initial freezing stage they will have pain and stiffness for about 6 to 9 months with decreased movements of the shoulder. In the frozen stage, pain might decrease, but they will have a restricted movement. And in the third stage or the thawing stage, the patient will gradually improve. This could last from 6 months to almost 2 years. Patients who are not responding or not improving on their own, they usually require assistance. Treatment is usually in the form of regular physiotherapy sessions. For some patients, we give intra-articular steroid injections. For some patients, we do something called as a hydrodilatation, where we inject saline along with an anesthetic, along with a steroid, and dilate the shoulder joint so that the capsule will get stretched and is again put on physiotherapy. Patients who do not respond to these treatments are advised arthroscopic procedure. In an arthroscopic procedure, we make stab incisions in the shoulder, put a telescope, view the whole shoulder joint and release the capsule, which is very tight, completely all around the socket of the shoulder, which is the glenoid. After the release is done, the patient is immediately put on mobilization with a physiotherapist. Most of the patients would regain their complete movement in a span of about 2 to 4 weeks. Prevention of frozen shoulder is very important. Whenever you have an injury, it is very important you do not keep the shoulder in prolonged immobilization. Post-surgery or post-injury, you are supposed to do at least basic pendulum exercises which are along the gravity and do passive mobilization with the help of physiotherapy. If you are a diabetic patient, you are at risk for developing frozen shoulder. So it is very important that you maintain your sugars and do regular exercises for your shoulder. Shoulder is a very highly mobile joint. So mobility of the shoulder is a very important aspect of the joint. To keep it mobile, you strengthen the shoulder muscles regularly by training the muscles around the shoulder. If any of you are suffering from frozen shoulder, we are here to help at Apollo Spectra Hospitals, Kondapur, Hyderabad.